There are PPOs, which are preferred provider organizations, and there are HMOs, and they work a little differently. But they all have a list of doctors they have chosen. And I'll tell you something, you don't want to know how they choose those doctors. It's not based upon quality, trust me. All right. Patients can then, you can shop for the best physician at the best price. And, you know, we're going to have full disclosure of prices. I was talking to a fellow today about a friend of mine. I wanted him to do an MRI, and this friend, I still, you know, practice medicine on the side for friends, you know, I don't charge him. But I called him to get an MRI, and he was telling me about how he is going to start publishing in the paper his prices for MRIs and the other things that he does, because they are so far below what the hospitals are charging around the Youngstown area. So telling people what you're going to charge them is just ought to be standard practice. And it will under this system, because this is going to bring an element of competition into the whole system. Now here's a very, very important part of this. It will deter overutilization. I'll tell you why. Yes. Here's how it's going to deter overutilization. You're going to be spending your own money out of your own health savings account. Now, I'm going to go back to pre-Medicare days. All right. Now, in 1965, Medicare came on board, and everybody that year was either born in 1900 or before, right? Okay. And all those people, my parents included, had gone through the Great Depression, and they were very sensitive about spending money. And you know, if you've ever cleaned out your grandfather or grandmother's house, you know, they kept a lot of stuff in fruit jars. You know, I mean, they had mason jars, and they had rubber bands that were all, you know, rotten. And I mean, but, well, you know something? Those people were coming to my office like they've been keeping their aches and pains and constipation and insomnia and poor eyesight and poor hearing in fruit jars. And they came in and they just dumped them all on my desk and said, "Doc, you fix it, because it ain't going to cost me a cent." And it didn't. Medicare was free. You could go to the doctor for free. You could go to the hospital for free. And you see, these jerks down in Washington hadn't figured that out. Because when they got the bill for Medicare, they were blown away. And they said, "Those greedy doctors." Well, it wasn't greedy doctors. It was conscientious doctors trying to treat every symptom that came their way from all these 65 and olders. And when they found out that free Medicare wasn't so good, they started taking a little bit out of your Social Security check. Now they take a lot out. And you still need copay. You still need co-insurance. So Medicare hasn't worked. Medicaid hasn't worked. This will work. And then this is the other thing. It's going to provide incentive to maintain healthy habits. You know, you might figure out that, you know, I'm draining my health savings account, but I keep having this incessant cough. I have to go to the doctor all the time. Maybe I ought to quit smoking. And then you figure out that both parents have diabetes. You don't have it yet, but you're 75 to 100 pounds overweight. Guess what? Your health savings account is going to be drained treating your diabetes if you don't get in shape. And so it will put personal responsibility in play, and people will start taking better care of themselves, like you take care of your car. You don't miss those oil changes. You rotate those tires so they last longer, right? Why? Because you don't want to spend money on your car. Well, you don't want to spend money on your body either if it's your own money in a health savings account. Here's the other thing, portability. If you decide you want to change jobs, You don't have to figure out what that new employer is paying for insurance for an insurance company, or if you'll fit into that insurance company, or if they'll accept you because you have a pre-existing disease. It's your business. You've got your own health savings account and your own catastrophic health insurance, and nobody can tell you what to do or what not to do with it. So you can move from job to job. So we want to let the market work. We will let free enterprise is what made this country great. Every small business in this country is successful because they either do a better job or they undercut price-wise the guy down the street. Nobody does well in business if they overcharge or if they give poor service. Well, this is going to make doctors give the best kind of service for the least amount of money, and we're all going to benefit from that. And that's it.
Thank you, Doctor. I would pause here and ask the technical folks. Do we still need to take a short break at this point for those purposes? Oh, okay, well then we'll plow right into Q&A here then.